Hello and welcome to our second webinar today in our series on continuing the conversation on piecing together support in a trauma-filled world. Before we get started, I'd like to remind everyone to please keep yourself on mute so that we can cut down on the background noise. Once again today, we will be recording this webinar and we will add it to the website that our friend Ed Dobelman created this entire series. I'm Vicki Phillips with the Mental Health Association New Jersey in Atlantic, and today, along with Carolyn Quinn, our Wellness Center Director with MHAAC, we will be moderating our session today. We at MHAAC are thrilled to be collaborating with CIT on these webinars. For those of you not familiar with CIT, the Crisis Intervention Team Program is a community partnership of law enforcement, mental health and addictions professionals, individuals who live with mental illness and/or addictions, their families, and other advocates. It's an innovative first responder model of police-based crisis intervention training to help persons with mental disorders or addictions access medical treatment rather than place them in criminal justice system due to illness-related behaviors. It promotes officer safety and the safety of individuals in crisis. So we have much to cover today. So let me begin by introducing our CIT New Jersey Director, Ed Dobelman. Ed.
Thank you, Vicki. First, I want to welcome everybody and helping us continue this conversation on mental health. Also, thank you to the Mental Health Association for the collaboration that we're doing. I just want to say a couple words. Unfortunately, all of you know, most of our first responders here have a culture of being silent when it comes to mental health. However, you are the ones that people call when they need help, and no one wants to admit it at times, but sometimes the helpers need help. I hope our speakers today that we have chosen with us and have with us today will help improve that situation and reduce that stigma. So today, I don't want to waste too much time. I just want to introduce Dan Farnworth. He's a paramedic based in the UK on the front lines of the ambulance service. He is also the author of 999, My Life on the Front Lines of Ambulance Services. He worked nationally creating networks of support to improve the health and well-being of our emergency services and the DHS. In 2017, he was lucky to work closely with the heads together of programs orchestrated by the amazing team at the Royal Foundation. Dan has worked to change conversations around mental health, striving to make the topic of mental health an acceptable and daily conversation. His hope is to support the ongoing work in the UK emergency and essential services to ensure that employees in the UK have a happy and healthy place to work. We met Dan through CIT when he was in our Bergen County area, so we welcome him. We also have across the pond on our side here, we have Mike Soma. He's been involved in the fire services now for 26 years. He has served as a firefighter, EMT, fire and EMT instructor, fire inspector, an underwater search and rescue recovery diver. He's involved in the Hudson County CIT program since 2016. And is currently in the hospital safety officer at Meadowview Psychiatric Hospital in Sea Caucus. So without further ado, I'd like to introduce those two gentlemen. And again, thank you all for joining us today.
Sorry, I'm just trying to unmute myself then. Thanks very much, Ed. I don't know if we still have Mike with us. I believe he's just been out on a shout. Are you still there, Mike?
I'm here. I'm here.
Oh, good. Brilliant. Well, as I say, both myself and Mike, I don't know if for the people I wasn't there for the first one, it was really good to engage in the conversation around mental health and also mental health within the first responder or the emergency services community. And one thing that we found is that it doesn't matter where you are in the world, we often have very similar problems. And when we came together, we started having quite an exciting conversation and learning quite a lot from each other. And I think that's where these conversations have grown from. I don't know if there's anything you want to say, Mike.
Yeah, the first program that we ran, we had some good feedback. It was good to shed some light on some of the concerns that responders have, some of the stuff that they're facing as we're dealing with COVID-19 and even more here in the States. So I think it was an excellent way to start it off, and hopefully today we'll be able to give everybody some more information as far as recognizing when you need help, knowing when to talk to somebody, and really who to talk to, who to reach out to. And I have to apologize, I'm a sweaty mess. We just had a 3-alarm fire. So I'm a sweaty mess right now. I'm sorry about that.
I think you look absolutely fine there, Mike. I wouldn't worry about that at all. I don't know if you, I mean, are we just jumping straight into the slides here, Vicky, or is there anything else to be said from your side?
I think we're just going to get to the heart of it. There's so much to cover, and I know you all have so much knowledge to share, and it would be great to just jump in there.
Yeah, absolutely. I mean, I think this first slide, what we've done this time, by the way, guys, we've put together a number of slides, not to really give it too much PowerPoint and to inundate you with statistics, but we just thought it may be better than just sitting looking at myself and Mike. And it also makes it just a little bit more engaging for you. I'll let you take this slide away then, Mike.
You're still on mute, Mike.
Still muted. I'm talking to myself. The last program, the first one that we did, we gave you some of these statistics. But the biggest thing is that we always want to avoid people seeking out the other ways to cope with dealing with crisis, dealing with these emergencies, dealing with the problems that we have. And obviously, the big ones being alcohol, drug use, smoking too much, using, vaping too much. But we want to avoid using those other coping mechanisms, those inherently dangerous coping mechanisms. We know as first responders, we have a very unique culture. A lot of what we do to cope involves being around each other, whether it be after bad calls or whatever, going to the bar, going out for breakfast in the morning, whatever it might be. But we just want to make sure that people avoid the bad coping mechanisms that do exist. But PTSD and knowing when you need to reach out to people is a very important thing. Next. So based on, how responders deal with our job, the biggest thing is 68% say that they have some type of emotional effect. 49% say it's organizational factors. There's a mental effect. 36% of responders say that. Physical could be anything from, developing some type of, back issues, or as well as difficulty sleeping, things like that. But our jobs affect us, whether it's EMS, fire, police. What we do, it affects us, and it affects our way of life. And the thing is, I think a lot of times we're very often ready to brush it off and say, no, I'm fine. But over time, everything starts to creep up on us. And it's making sure that we don't let things build up to the point where we become a powder keg, and we address things as they come, and recognize when we are having some type of effect from dealing with, whether it be a bad call, whether it be a life-threatening situation that we had to deal with, but definitely recognizing that we have to address it early on.
Dan and Mike, do either of you think that, in your experience, that many EMS people think that their own lives draw into account? Like, do you see that some of your colleagues don't recognize when the trauma in their own lives adds to what they're already dealing with being on the job?
Oh, absolutely. I think one of the biggest things that I often say, especially when I do stuff in the fire service, is there used to be the old adage in the fire service, home is home, work is work, and you keep the two separate. But anybody who's ever had anything happen, I'm sorry, the speaker's going off here. Can you still hear me?
We hear you.
is that anytime, you've had anything go on in your life, that outside factors, non-emergency related, do affect our life here. And that goes hand in hand and with some of the stuff we're going to talk about later is, as you know, for supervisors and for other people involved in whatever aspect of emergency services, is that we all know who we work with. Look for the signs of somebody dealing with some type of stress, and know when to step in and ask somebody if something's going on.
Great, thanks.
So first responder stresses, the number of hours that we're called to work, bad calls that we have, the lack of pay, or especially now for a lot of responders, we're called to, in politicians' terms, chip in and take cuts to whether it be our salaries, take cuts in health benefits, whatever it is, but it affects everybody's environment to work. It's another stressor for people, especially for newer responders and EMS, and I'll say it, I know it's one of those things, the way EMS gets paid in the States is not on par with what the fire service does. And it's definitely a stress. I know a lot of paramedics and a lot of EMTs, people that I've worked with for years, people that I've grown up with that are paramedics and EMTs that, they're working at 2-3 hospitals to make ends meet. That's a lot of stress. That is a lot of stress, and it needs to figure into the stress besides the job.
Now, is that the same over in the UK?
Yeah, I would say so. I mean, it's funny when there's lots of similarities, and I think one thing that I found really interesting is the political aspect as well. So you get told that as well, Mike. The service there, they want to support us, but obviously it always rolls back to politicians. But I suppose we'll leave that one there because that's a whole other story and debate. But a lot of the issues that we discuss, a lot of the stresses, a lot of the factors surrounding the issues faced mirror pretty much exactly. And it's really interesting when we look at this and we actually start realizing that the stressors remain the same. It doesn't matter which side of the pond you're on, the stressors remain the same, if not very similar.
You can go to the next one.
So yeah, this is the slide. Just really discussing when we should seek help. And I mean, for me, the initial thing I want to highlight that it's okay to seek help anytime. You don't have to wait until you have a particular stressor. You can seek help just because you feel like you may need to. It doesn't need to be a specific reason. You may just have that gut feeling that something isn't right, and that is absolutely fine. There doesn't need to be an exact reason. However, when we look at it, there are absolutely things that you can look out for. And I think one of the biggest ones, and certainly for me, when I had a difficult time, the first thing that started getting affected was sleep. And I realized I wasn't sleeping very well. And then I became isolated and withdrawn. And I did start finding it difficult to enjoy life. But all of these things are not mutually exclusive. It could be something totally different. But at the same time, when you look back and you can see it methodically, it makes sense. At the time, it's hard to realize that actually something is bothering you. So sometimes it's not always quite so clear. You may think you're just having difficulty sleeping for whatever reason. You may not be able to tie it down to a particular cause. So I suppose what we're trying to say is that actually it's okay to reach out for help anytime, but there are certainly things you can look out for. And a few of the examples, of course, are on the screen there. But I think we just wanted to highlight that it's always okay to reach out for support. And there's numerous ways you can do that, which we'll go on to shortly. So where to get help? I think you'll have to bear with us. We've had a last-minute change of slide, so we've had the merge. So we're working difficult times here, aren't we, Mike?
Yes.
But
Especially when
but,
email
I mean,
systems get locked down.
but, yeah. But where to get help was kind of one that was really important, and I personally tried to break it down into numerous categories: support at work, support at home, and they're the two most important ones, I think, because they can be informal, just day to day. How are you? How you doing? And I emphasised last time that when you ask somebody how they're doing, always listen to what they've got to say, because if somebody says to you they're not doing well, or you walk into a room and say, "Morning, how are you?" and somebody says, "Oh well, you know," and it's easy to brush that off and not listen to what that person's trying to tell you. So I think that's really important, just from a listening point of view. But places to get support, like I say, are at home, at work, formally or informally, and of course, there's always the family GP. There's employee assistance programs now in pretty much most employment places. I know in the service I work for, we've got a really good one called Help. And you know, they are out there. But if you're in an area where there's not something along them lines, there's mental health organisations. I know some very good ones, Vicky. Lots of signposts and lots of resources available. So I think if you was looking for support, look what's specific to your area. If you were looking to put something together for your colleagues or to support somebody in particular, really good to write a list down. So you've got that toolbox, and we talk about this quite a lot. We spoke about it last time. Have that toolbox ready. Know where the support's available in case you need it, or in case any of your colleagues need it, or any of your family need it. So it's there and ready to go. It's like a kind of just in case. It's there should you need it.
And especially those people who are there as heads of an organization, definitely you should be looking into what peer support programs are available near you, especially if it's, whether it be union-based, whether it be company-based, it could be, you know, an EAP. So whatever it is, make sure that you have it. Make sure that someone within the organization tests it out and make sure that it actually works. And there has to be some type of communication between both sides to really make it work.
Before we go too much further, I want to just ask both of you, there is kind of that, you kind of alluded to it, Mike, about the kind of the tough guy can, you know, I can handle this, keep work at work and home at home. But can you speak to the kind of the culmination of compounding trauma, like as you know, time goes on, it may not be that one event, but suddenly it's some little thing that triggers it so that it just all comes crashing down at once. And people don't often understand why it's that one event when went through so many other things that were much worse.
Yeah, I think for myself, as one of the peers that goes out and does the critical incident stress debriefings and stuff, a lot of people always call me and they're, "Oh, I have a new guy." I love when I get those phone calls. "I have a new guy." And when you go and you start talking to everybody and you bring everybody in and you give them who you are, your background, and then you say, "Listen, just give me some background as to what happened," and you start, it's people who have been in the emergency services for a long period of time. They're the ones that generally start to speak up a little bit, because I think as the way it's always been in the fire service, and I'll use them as the basis, is where I get the most calls for. It's always been that tough guy, you know, stance of, I'm fine. And you just put it in the back of your mind and you go to the next incident and the next incident and you keep doing it. There's only so much that you can do that before it, you know, you can keep stuffing everything in the bag, but eventually the bag's going to burst. And the biggest thing is when you get to the point where you're showing the outward signs of it not being okay, of having that you're in crisis from what you've been dealing with, we want you to recognize it earlier and talk about it earlier. And I have to say, this is where all of us as emergency responders, I don't care if it's police, fire, EMS, we all kind of need to take a step back and pat ourselves on the back, because I have seen in the past few years a huge change in the conversation. People, especially supervisors, especially departmental chiefs, commanders, that they have stepped up and they've made phone calls. And I've gotten 10 o'clock at night phone call. Hey, listen, could I just bounce something off of you? You know, and when they step up and they say, hey, listen, we need to talk about this, we've made a huge step forward in dealing with what our membership, whether police, fire, EMS, as responders, we're dealing with, and recognizing that we need to deal with it and not push it, you know, sweep it under the rug and take that macho man, you know, I hate to use that terminology, but use that as our, you know, montage for dealing with crisis. It's just, it never works well. It never has, it never will. So now that we've made that change, I see a positive for responders.
Mike, I just want to bring up, Mike brought up a good point. You know, we have a new guy, and now the supervisors are stepping up. I know in law enforcement, it used to be, you know, the first time the new guy sees a dead body or a traumatic incident, it's like, we didn't set him up for, we're almost set him up for failure, because we're like, watch his reaction or watch his effect. Instead of letting him know, like what we're talking about today, that these things are going to build and these things are normal, then to reach out for help. So yeah, I got to admit that I think we're starting to change our supervision on, hey, when you see these things, these are going to react, or you might react this way. And then, you know, that is a normal reaction to an abnormal event. The second question I had for you, Dan and Mike, was, how about anything towards your significant others? Because they might recognize it before even you do.
Yeah, I'd agree with that. Perhaps they do. I mean, ultimately, for me, when I went through the really difficult times, I did start crumbling. And the place where I started crumbling most was at home. And that was recognized pretty quickly. And actually, you know, when you go into work, you may just look a little bit withdrawn. And then that's maybe, you know, might have thought Dan's just in the mood today, which, you know, he's withdrawn, just leave him to it. But actually at home, there was that recognition of a change of routine. Now, not everybody's married, you know, so not everybody's got that support mechanism in place. But quite interestingly, on the Winston Churchill Fellowship, I travelled across the US and Canada, and I actually came across some services that were inviting families in. And we touched on this on the first episode, that actually there are services out there that will invite the family in and, you know, not the staff, just the family, to thank them for a start, for letting their significant other work all these hours, but also to give them a little bit of not just a thank you, but to give them a little bit of a heads up to what to look out for and who they can contact should they feel concerned about their partner. So I thought that was quite important, and I think it's something that we can really focus on when moving forward. The other issue, I suppose, what we're talking about with the macho culture, the stiff upper lip brigade, as it's sometimes known. Basically, what that is stigma, and it's a really big issue. I remember talking about seeking support. Stigma is the biggest underpinning issue. Now, I was concerned to reach out for support because I thought that it may affect me at work. People may not want to work with me. And that wasn't the case. That was simply just the stigma. And some of it was the stigma that I held, and some of it may be the stigma that I'd been around previously. And I suppose I took from that is that we all have a responsibility to ensure that everybody is able to talk openly in our play around us. Everyone's allowed to speak openly about their mental health. And it's kind of the culture that we create. And it's really important that even if we're in a good place right now, that we're creating a culture at work in our place whereby you're okay and you're able to talk about it, because that's the culture we create. And I think that's really important. I don't know what you think, Mike.
Absolutely. I think the biggest thing is when it comes to family, one of the things I had said in the first one was don't lock your families out. And I gave my story of basically going home, and although I had already mowed the lawn, grabbing the lawnmower and just needing to mow the lawn, and then my wife's, standing at the door screaming at me. It was because you had a bad day. I just needed to let off steam. And it was the one thing that just is the mindless activity at home that I could just do and just go. And I never thought of things from her aspect of, I just didn't want to talk to her and tell her what was going on. I just wanted to basically do some mindless activity just to try to de-stress and just ground myself a little bit. But it's really important to involve your families in things that are going on. We don't want to have the secondary trauma. We don't want to start, making it worse on ourselves, but we also don't want to traumatize, our spouse or a loved one. It could be a parent that we're dealing with. But it's that big thing of we need to let them in a little bit more. So.
He's getting calls again.
No, it's not us. It's just the speakers right next to me.
Okay. Carolyn, you want to?
I love this question of what are the fears of talking. And I'm wondering if, Dan and Mike could maybe hit upon, some myth busters of knowing that there's potentially a lot of fears, especially, in the public service arena of folks getting help. But, what can you say about how to take away those fears?
Well,
I think mythbuster number one. Go, Mike. Go, Mike.
No. I always say the biggest one is confidentiality, and that is the basis of everything that we do. Is that where nobody's running off and telling everybody, what the problems are, and if that's happening, then it needs. That's why there has to be a formulated program. So there has to be a mechanism for people to address when somebody is breaching that confidentiality. Everything we do as peers, that is the foundation of our program. If we start running around and breaching confidentiality, my program is shot. I'll never have another person call me. I'll never have a department reach out for help. It destroys everything. So the confidentiality, again, is the basis for everything. We don't run around. And that's the most important part. Sorry, Dan, go ahead.
No, I think you kind of hit the nail on the head, Mike, to be honest with you. That's absolutely spot on. I mean, I think people are genuinely concerned that if they're going to approach a peer supporter, or if there's no peer support system in place, approach a manager, that, next thing it's going to be the weekly gossip around the station. And that can't be the case. As Mike says, there's a formulated plan over there, which is great. And that absolutely is not the case. And I would like to think that no matter where somebody approaches people for support, that confidentiality is at the top of the list. And then I suppose really for me, the second biggest myth that exists out there is people often think that if they're going to reach out for support, that means that they're admitting a weakness and maybe a fact to recognizing that they can no longer do their job. And actually that is a myth. What people are doing by reaching out, they're showing strength, they're showing a good foundation of looking after their own well-being. And actually what you're doing by reaching out for support is making yourself a better person in the long run. You're encompassing yourself with tools to support yourself going forward. And I mean, that raises another question. What do we do for the people who don't talk out? How do we encourage them to talk out? And I think that will come out of this conversation as we go on. But I think that's key, that people are able to know that when they talk out, they are going to be supported, and it makes them a better and stronger person for doing so. They may not feel like it at the time, but they absolutely are.
Well said. I did want to, quickly show if there comes a point as someone is, you know, potentially reaching out for help, or potentially someone is hitting upon some of these barriers that we're trying to, you know, kind of move past right now, and there is a concern for someone's safety, just talk a little bit about, you know, potentially warning signs. And so when we look at whether it be fire, police, veterans, EMS, there is a high rate of suicide. So keeping that in mind of, you know, these traumas building upon themselves and things like that. So warning signs can look like threatening, writing, posting on social media, the desire to hurt or kill oneself, seeking access to the means, hopelessness, helplessness, potentially engaging in risky activities, that increase in drug and alcohol use that we've been talking about, that withdrawal from family, friends, society, that, you know, exactly as we were talking about looking for help and who to get help and support from, withdrawing from that. Demonstrating rage, looking to seek revenge, appearing agitated, feeling trapped, having a dramatic change in mood. This is a big one in the mental health field that someone might assume that it means that somebody goes from feeling well to extremely sad. But when it comes to warning signs for suicide, it can actually be that someone has been down for a long time, that we've been concerned about them, and they now have a little bit of an uplifted mood. And so our reaction might be, because we've been wanting them to get well, is, oh, they're okay. And, you know, kind of potentially giving them some more space. And actually it could be when they need our support most. For some people, making that decision to end their life is very hard. And kind of knowing that there is an end can actually make the mood a little bit more uplifted. So it's definitely something to keep in mind. And so if you are concerned about someone, making sure to ask directly whether the person is suicidal. And as a friend or a family member, thinking to, you know, use these words can be very challenging. And the best thing that you can do is ask directly, are you having thoughts of suicide? Are you thinking about killing yourself? I will promise you it'll be one of the hardest questions you ask that day. However, it can be life-saving, and it's so important. And there's been a lot of research to say that if you do not ask this question directly, just like we see here on the screen, are you having thoughts of suicide? Are you thinking about killing yourself? That you might not get an accurate answer. There's a lot of research that shows that the person will be honest with you if you ask in this way. So as challenging as it might be to think about asking a colleague, a friend, a family member, it's the best life-saving question that you can have in your back pocket, and really encourage, if you are interested in getting more training around this, this slide and curriculum is from the evidence-based practice of mental health first aid. But we felt like as we were preparing for this webinar, and I will be handing it back over to Dan and Mike, that it really is important to make sure that we're kind of hitting upon if it ever gets to a point where somebody's well-being and their safety is a concern. So there's the National Suicide Prevention Lifeline number, and there is the National Health NHS has the 111 option too. There's lots of help out there, but we really can't emphasize enough the importance of, if you are concerned about someone, asking someone if they're having thoughts of suicide. Dan, Mike, I don't know if there's anything you wanted to, you know, add upon it, or, you know, to kind of move forward to look at resiliency, but, you know, I know we wanted to talk about that.
I think echoing what you've just said, I mean, I think that, you know, if you've never actually asked anybody that question, you'll never know the response. And I think, like you say, it is a life-changing question. And I think Mike will be the same, that thankfully it's rare that peers will say yes, but it does happen. And it's important that we know, because then we can get the support for the people. It does happen a lot in our frontline duties as paramedics, EMTs, going out there, supporting the community, that we do ask that question an awful lot, and we've become really good at asking it. And it's surprising how many people do confide in you. And by being as blunt as that, it does actually change the conversation. And that you can see, once somebody does confide in the fact that could be how they're feeling, that you can see that the weight of the world has been lifted off that person by just explaining and opening up as to how they're feeling. So yeah, absolutely spot on. I totally agree with that.
Yeah, and with that, one of the things that you have that feeling hopeless, and we were talking about, you know, the stigma and the myths, is that no one is beyond help. We can help everybody in whatever situation you're in, and definitely knowing that they can reach out. So that is one aspect of it. As far as the, you know, asking, you know, talking about suicide, with our program with the International Association of Firefighters, we spend a big chunk of time with our peers talking not only about suicide, but about how to bring it up. It is one of the most uncomfortable yet necessary things that every single peer learns how to do, is crisis, and that it is a potential thought in their head. You need to come straight out, ask them if they have the intention of killing themselves, finding out if they have a plan, because that will gauge the most imminent threat, and you need to get someone help immediately, versus someone that you can potentially talk to that's having a thought just of doing it down the road, or it's creeping into their thoughts, as opposed to someone who actually has a formulated plan to go out and do it. And those people, we need to address it right there and then, at that moment. We cannot wait.
I think that's all well said. And I wanted to highlight something that I think both Dan and Mike kind of hit upon, is that, you know, there's a lot of training in being able to ask this question to the public that you are going on calls to, but having to ask that question to your friend or your colleague is very different, but is, if anything, more important, because people might not be looking to ask, you know, our first responders. So keeping that piece in mind and the importance of it. So thank you all giving such good info. I'll leave this slide up about resiliency, because I know there was a lot of points that you wanted to kind of hit upon before kind of looking at that wellness toolbox.
Mike and Dan, there's a question in our box, and I know from law enforcement, to be a peer specialist in the EMS or fire field, do you have any suggestions for anybody that's interested in that? And I know for law enforcement, for those who don't know, we started a resiliency program last year at the AG's office. Every department has to have a resiliency officer. As far as a peer, what the question was is peer-to-peer for law enforcement. I believe Cop to Cop is a peer-to-peer program, and you'd have to reach out to your other counties for your other programs. But Cop to Cop is a nationally known program. How about in mental health peer-to-peer in mental health in the fire or EMS service? Any suggestions?
Well, for us in the States, we have, if you're an organization that's in the International Association of Firefighters, we do have a training program that's delivered. But there's also other organizations out there, the ICISF, the International Crisis Incident and Stress Foundation. I believe they're down in Maryland, Delaware, down in that area. But they do deliver training. They go out and deliver training throughout the country. And I know that they now, with COVID, they have an online program as well. But definitely it needs to be a program with some serious substance. One-day programs are very difficult. I went to one program. It was a one-day, and it really gave you no true background that you need. And definitely, if this is what you're looking to do, going through the International Crisis Critical Incident Stress Foundation is a good start. And they have multiple classes that you can take in different types of tracks, whether it be police, fire, EMS, as well as just retraining and keeping up with it, and getting with some of the other organizations that are out there. I try to deliver trainings, not just on the department level, but also within the union itself. I don't know about over by you, Dan.
Yeah, I mean, I think it's very similar, county to county, service to service. There's a huge variety of what's available within any given service. Service I work for, investing heavily in time and funds to try and really create the bespoke peer support package. But like anything, it takes time, and some services aren't really necessarily looking into it yet, which is a crying shame. But there are other options out there, like you say, Mike. I mean, in the UK, we've got the mental health first aid training, which I know exists in the US in a slightly different format. But for anybody who's really interested in just having an awareness of what to do and how to support somebody in mental health crisis, I think that's a really good starting point, just to give you that awareness of what to do, what to say, and why it happens and what happens, and the bits behind the scene. Like Mike said, there are one-day courses available, which are great. They give you a great underpinning knowledge, but sometimes you do walk away with more questions than answers, and that's why it's important to really get a good course. If you're wanting to offer a true peer support program, we need to be investing in the time with the peer supporters to really give them that underpinning knowledge of why and how and when to support people, and when, often, like we've just explored, is one of the biggest and most important things. Yeah, nothing else to add with that, really, other than you know, look at what's available in your area. I know, obviously, we're not all from the same town here, so I mean, there's lots of different things going on. I mean, for me, it would be great if there was some sort of, you know, national or international registry where all the services came together and there's a big list of what's available for your profession in your area, and they all work together. I've had that pipe dream for a while, but I think the work to get all that together would be absolutely astronomical. But I think we're taking the right steps so far.
Yeah, I agree 100%. Even in the state of New Jersey, we're so spread out. There's so many different organizations going in so many different directions. I'll give you an example here in the state of New Jersey. So I have the Professional Firefighters Association of New Jersey, and I run their peer support program. But we also have the Firefighters Mutual Benevolent Association, the FMBA, in the state of New Jersey, and they have their own peer support program. And we're running side by side here, and myself and one of the gentlemen who is one of their peers, I keep saying to him, if the two of us can just get the two programs together running on the same tracks, we'll actually be able to try to get this going in a much better, useful direction in the state. Again, this is, you know, I say I'm from the PFA-NJ, but there's many times where my phone rings and it's the other union's member, and I never say no, and it might drive other people crazy, but if you're a volunteer firefighter and you reach out to me, you get my number from someone and you reach out to me because you're in crisis, I'm going to stop what I'm doing to help, because that's why I got into doing what I'm doing, is to help people. It's not based off of what my union is going to do or where I got trained from. So it's really important that we try to pull some of these programs together. And again, even on the EMS end, I know in the state of New Jersey, I can't speak for everywhere in the country, but it is one of those places that we really are lacking assistance for our responders, is in EMS. And again, I've never had an issue stopping and helping someone who's called from an EMS organization, even if it's a private EMS organization. So definitely there's stuff out there.
There's an interesting question in the chat about how trauma affects our brains and bodies. And Gwendolyn specifically asked, do we promote journaling, or do you all promote journaling or telling stories if they want to share?
I think on that point of view, I think how trauma affects us is it can affect us in many ways, and it doesn't always necessarily affect us in a bad way. I know if you're dealing with a traumatic incident face to face, the way your body copes can actually help you focus more and help you get on with it at the time. I suppose it's the other side of the coin is if you're having trouble with it, and the way it affects you, physiologically is quite a deep-rooted and hard to explain thing. I think it's individual. It's probably not fully known why it affects us the way it does. I think some would say it's a normal human reaction. I mean, I don't know what your take is on that, Mike.
Yeah, I think journaling is one of the greatest tools that anybody can use, and for multiple reasons. So the first is it helps you keep track of where you are, not only emotionally, but physically. It's almost like a sleep diary as well. Some people do it when they go to bed, or if they have a problem sleeping, they'll sit down, they'll start writing out some of their stresses. So it's a barometer for where you are. But as you go on in journaling, it also is going to help you as you start to build your own resiliency. It's going to give you some place to go back to say, look at how far I've come. So really journaling is an amazing tool to use. I know it can be very hard for people to start. Very often that's the biggest question I get is, how do I start? And I wish there was an easy answer. Get a journal and just write little one-liners to start. Today was a good day, problems, or today was a really bad day. I can't stand working with this person, and just, you'll get into it. It might just start as 1 or 2 lines, but it will grow as you go through it. Definitely use it as a tool though.
I think just to echo that, I think journaling is really important. It massively helped me. I was trying to avoid it, but the notes got turned into a book, so what's not to love? But I think one thing that I really did when I was journaling is I put at the side, I put a plus or a negative. So if it was a positive moment, it was a plus. If it was negative, it was a minus. And what I could do is, at the end of each week, I can look and I see that the pluses far, far, far outweighed any negative issues or anything negative that had happened in my life. But of course, your body's programmed. You only ever remember the negative. Not always, but in the main, you remember that negative aspect. I had a slide, and I don't know where it is, Caroline, but it was a little bit cheesy, to be honest with you, and I stole it from TikTok. But it actually said, if you had $86,400 and somebody stole $10 from you, would you be angry and throw away the $86,390? No. Well, if you are, send it my way. But the interesting thing is there's 86,400 seconds in each and every single day. So why letting 10 negative seconds ruin the rest of your day? I think that was really important, ties into the journaling really well. When you put a plus or a negative and journal right and journal well, you'll see that there's so many more positive seconds in each and every day. And I think that is so important.
Exactly. And one of the other things that I've said to people in the past is, when you find yourself falling into the negative zone, you're focusing so much on the negative, is to always try to talk about one positive thing in that moment. And ultimately what it will start to do, it will start to change the way you're thinking about everything. You have to start looking at the positives. It's very difficult to do, but always focusing on about the one you just had.
I
Absolutely.
love
So I
that,
don't know.
Mike. And I have to say, a lot of times when I work with clients, they'll talk about that there's nothing positive, and we have come up with, well, you're here, and that's the positive, or that they're talking to you, and that's the positive. So there's always a positive to be found. You might have to be a little creative.
Definitely.
So we've got a little bit less than 10 minutes left, and I know we have some time for, some more questions Vicki might have ready, but it really this kind of, idea of next steps. And I know you also both wanted to give a little bit of a preview into our third kind of part of this webinar and talking about having kind of a plan and what folks can do.
I also want to give, this is a very good question. And I think it goes back to your analogy, Dan, that you were talking about the 10 seconds. And the person said, have you ever encountered the 10 seconds that keeps intruding into your daily life regardless of your efforts to press forward? And if so, how have you been able to fully move on? So, and I think that's great because sometimes there is that invading thought or that invading feeling that keeps coming back that does sometimes paralyze people. So how do you move past that, or how do you know it's time, probably a little bit more than time, to get help?
I think it's really important. It can overwhelm. That negative 10 seconds can be very overwhelming. And of course, often it's more than 10 seconds. Let's be honest, it could be 10 minutes, 20 minutes. But it could be even longer. It could be a negative day. But I think the emphasis is trying to isolate that, and that thought, trying to not let it overwhelm you. There's lots of techniques out there. There's the grounding technique. Some people even take the shoes off and go and stand outside and feel grounded and let the thought go. There's lots and lots of tips and techniques out there, which the peer supporters, I know Mike will have lots and lots of them out there. Different agencies can give you techniques on how to release that negative 10 seconds and to kind of throw it away, as it were. But I think, that's where it comes back to journaling as well. When you can look back and see that you've got more positives, hopefully anyway, you've got more positives. And also you can notice if there's a trend of negatives, and there's maybe something you can do to remove that negative. And that's where we look back to the daily checklist that we had. Is there more we can do to try and do more positive things throughout our day? Is there more positivity that we can bring ourselves? And actually, is there more positivity we can bring others? Because I always find sharing positivity, you often get positivity back as well.
Yeah, and there's some great mindfulness apps out there. There's some great stuff that you can download right onto your phone to do 10-minute meditations and things like that. And even for people who are having difficulty sleeping because they have a lot of things running through their heads, those intrusive thoughts of the stress of the next day, or problems that they have to deal with at home, or problems that they're encountering at work. Sometimes it's promotions or things like that. Being able to download some of those apps that can just help you to relax, become mindful about things that are going on, it really is a great help. And use everything to your advantage. We live in such a digital age now that, forget all the bad stuff, the Facebook horrors and all that stuff, but look at the great apps that are available to really help us become grounded and deal with the stress that we're under.
Absolutely. I'll just add to that. One of my personal favorites is on Spotify. I know not everybody's got it, but Spotify's got a section now. It certainly exists on Spotify UK anyway, and it's called Daily Wellbeing. And it's a 30-minute playlist of, there's about 3 songs in there, and then there's intermittent speakers and positive thoughts, and it's really great. And I listen to that every day on my morning drive, or if I've worked a night turn, on my way home to bed. But I find it really good, and that little tools, like Mike says, really are useful, and it's getting used to using them as well. Because some people, they don't really want to do that, which is fine. There are other techniques, but if you get used to using them, they really will help.
Any others?
I think, Dan, you're also hitting upon that it's really important to practice using these techniques even when you're not having your worst day. So they really tend to be more supportive and helpful when you are having a rough day because you're in the habit of using these techniques.
Yeah, absolutely. I think for me as well, Mike said earlier, establishing your baseline is incredibly important, and use the techniques, use what's available to you, and use a daily checklist or whatever, but you'll actually understand what your baseline is when you're in a good place. And then to bring it back around to what today's about, if you establish your baseline as an individual, you'll know when things may not feel right and when things aren't going as well, and you'll be able to understand a little bit more when you need to reach out. But like we said earlier, in the way we started the whole webinar off is, if you're not sure whether to reach out, when is the right time to reach out? Anytime is the right time to reach out. Absolutely any time at all.
Yeah, and you have to, again, setting up some type of list of resources that are available to you. Like Dan just said, getting those apps downloaded, trying them out, using them, finding one that works. Again, when something is going on, it's the hardest time to start, because if you think about it like this, you're under stress, and now you go and you're having a problem sleeping, and you remember this webinar, and you go and you download an app, and then you get frustrated because you're trying to use something that you've never used before. Now you're getting frustrated, and you're so ready to throw it away and say, "Oh, that didn't work." And yes, because you're under stress and you're trying to do something to relieve your stress at the moment where it's going to be almost impossible to learn something new. So it's really important that everything we do, whether it be mindfulness apps, whether it be meditation apps, whether it be using podcasts like Dan said on Spotify, but do it now. Set something up now. Get it in your phone. Learn how to use it. Mess around with it. We all have that dead time where we're just on our phones, maybe forego, your little golf game or whatever it is, and learn how to use that app and what's available, so that when something happens and you need to use it, that you don't increase your stress level when you really don't need to increase it any more than you're at.
Mike, I'm so glad you just said that. You just described all of the end of March for my world, trying to learn new things in a very quick way, coming on all these platforms of Zoom and everything else. I know we're almost at the end, and I really want to thank both of you. I'm sure we'll stick on for a couple more minutes if anybody has any more questions. I am putting in the chat box again the site that our friend Ed Dobelman put together, talking about this whole series of the conversations that we're having. We are again having another one next Tuesday, and we're going to be talking about resilience and what kind of programs people can create if you don't have something in your community already, and look at some models. And please, you'll see that the first conversation as well as today will be on that website. So if you have friends or colleagues that have missed the first two sessions, they can also go on and listen to them recorded. Helen, Ed, Dan, anything that you want to add?
I think I'll just add to that. The website is absolutely superb. I think you've done a really good job there, Ed. But I think one thing we did discuss is we talk about numerous resources, talk about having the toolbox that we mentioned for where to get support. And I think we're going to try and add to that and put a few things on there as well. The service I work for, I've just put together an amazing pamphlet or leaflet targeted for the staff. I'm sure there'll be no problems with us putting that on there for people to have a look how we've done it and to take away and to make it your own. I think it's a really good tool, so definitely absolutely have a look at that website and watch it develop and grow.
Yeah, I was going to say, anybody that's joining our conversation, if they have anything, feel free to email me, and we can always add that resource. Mike and Dan will say, you got to find the right resource that works for you. There's plenty out there. Just find the one that works for you. That's why there are so many and different ones and different approaches. So I would be happy to add them on there. And just thank you for joining us again. And this is a message for loved ones out there. I mean, if you go to that website and you see those things that we talked about today, flashbacks or your loved one having trouble sleeping and all that stuff, look up the resources and maybe just offer it to them through yourself. Take that time to look up at the website or a resource or a link. And like Dan said, use it to what you need to, change it. But just get the conversation started and you'll be in a better place, hopefully.
One thing that I want to add was we had talked about a resource that's out there, especially for those in New Jersey, for our police side of things. It's called Cop to Cop. One of the biggest things that I always say is not every therapist, not every psychologist or psychiatrist is a good fit for a first responder. I don't care if it's police, fire, EMS, even our military brothers and sisters. The biggest thing is that we are under an enormous amount of stress, and they sometimes are a group that really don't get our culture. So Cop to Cop actually has a database of therapists, psychologists, psychiatrists who work with police, fire, EMS, military. So if you're looking around and you really need to talk to somebody and you can't find somebody, calling Cop to Cop, they will be able to give you someone close to you. That's always a big thing also when it comes to seeking help, that if you do need help, that you're getting someone close to where you live. Because if, for me, I'm in Jersey City. If I have all my therapists and psychologists in Jersey City, the problem is if my firefighter in need lives in Ocean County, what is a psychologist or therapist in Jersey City going to do for them? That's again, adding more stress, which is what we're trying to avoid. So getting someone who can not only deal with someone from our background or understands our background, plus is accessible to us, is a huge weight lifted off our shoulders. So definitely, again, going back to that whole toolbox, setting something up early on. Know what your resources are local to you. If you're a supervisor, if you're looking to set up a program, make sure that you call some of them. Set up an interview time with them and say, listen, we have a EMS organization that's trying to find somebody who's going to work with us, that's going to be accessible to us. Maybe they accept your insurance policy and you're just trying to get somebody who you can send your personnel to. Try to set up an interview with them. There's online guides as far as first responders, the questions to ask mental health professionals. Definitely something that you want to look into early on.
Yeah, and I think that's, correct me if I'm wrong, I think that's what our final and last webinar is going to be, is those resources. So hopefully we'll have some of them here to provide some questions and answers for everyone. And one thing that we didn't mention is the religious side. Our chaplain programs here in New Jersey. I don't know if, I know we have them on the fire and EMS and law enforcement sides. I don't know if Dan has them across the pond there. We call our chaplains, they're part of the department.
Yeah, again, it's on a case-by-case, county-by-county issue, but in Scottish Ambulance Service, we have a chaplain. Absolutely amazing gentleman, who actually comes from over the pond himself, but he's now over here wearing his kilt or whatnot. So yeah, he's a born again Scottish chap now, and he's doing a great job for us over here and really helping to guide us.
Wow. Sorry, go ahead, Carolyn. Were you going to say something?
The only other thing I wanted to share is that someone in the chat had kind of brought up a little bit more, when we're talking about crisis and suicide, and was kind of asking if there's any advice you can give regarding the misplaced sense of guilt caregivers can experience over someone that may die from suicide. And I think that we've talked about kind of actually going in much more depth of maybe doing, a webinar in the future, much more around suicide. But I wanted to, hand that off to Dan or Mike to see if they wanted to make any comments, and I can surely, share some info as well.
I'll just add to that. Suicide bereavement is a very, very difficult thing, and it's not just the direct relatives of the person who's died by suicide who is affected. It's could be anybody who's had any sort of relationship, or anybody who even just heard about what's tragically happened. And there are some really great suicide bereavement resources out there, which we can certainly bring along, add to the website. But I think, like you say, I think that could be maybe a specific conversation, a webinar, whatever we call it in the future. But suicide bereavement is a huge thing, and a very important subject about how we support people following suicide.
Absolutely. And I think, the unfortunate answer, as in I think a lot of what we've talked about today, is that it's complicated and it's not easy, and there's no one size fits all kind of response. There is actually a great TED Talk by a gentleman who's a first responder named Kevin, and he responded a lot from calls that he would get of individuals that were on the Golden Gate Bridge in San Francisco, potentially attempting suicide from jumping off the bridge. And he talks about talking to folks to try and have them consider, not jumping, and also the guilt and the challenges of losing folks as well. So there's, I think, a lot of, specific to first responders who might get called upon a scene and maybe trying to engage someone and might lose them. So there's a lot of aspects to this, and unfortunately, we don't have time to cover them all today. But I think that the one answer that we can give right now to this is the importance of self-care, as we've talked about all throughout this, having that plan, having those resources, having those apps, because it's very hard. And feel free, I dropped my email address and can definitely connect any additional questions around this with Dan and Mike as well. And I think, this is maybe showing us the importance of, maybe having a follow-up after next week around this topic. Anything else, Mike, Vicki, Ed, to add to that?
I think just the biggest thing is, again, as far as suicide is concerned, making sure that you have, especially for caregivers, someone to talk to. Setting that up is a big thing. Self-care is huge. Even for our first responders, you really have to focus on your self-care. And I always say this to my peers that work with me. If you ever feel like you cannot handle something, if you feel that you need to take a step back, then that's what you need to do. There's no shame in saying, listen, I need to take a break for a week or 2 weeks and just, even longer, and take that step back. But you really need to focus on your own mental health and even caregivers. You're in a boat of, you're dealing with someone's illness, helping them through it. And it's a lot to deal with. And then especially if they have thoughts of suicide and you're trying to basically be their emotional lifeline, and there is only so much that you can do, and knowing that you need to bring in somebody else for assistance and help, not only for them, but to also look out for you as well.
And I think that's an excellent place to end. I know we've already gone over, and we could probably sit and talk for another hour, but I want to be respectful of everyone's time. And thank everyone for joining us today. I hope you got a lot of information out of what we began talking about a couple weeks ago and now continued today. And again, we will be joining together again next Tuesday at 2 o'clock. You'll see more announcements up, and also I put the website up again for you to go back and check if you missed part 1. Mike, Dan, Ed, thank you so much for all your wisdom and experience and bringing it to us and sharing with everyone. And for all you that joined us today, thanks for coming and spending an hour with us on this hot, gloomy day, sticky day. We hope to see you next week.
Thank you to everyone.
Bye, everyone.
Bye. Thanks for joining us.
Thank you.